Okay, welcome everyone to the Brett and Larry podcast show from Coronado, California tonight. So we have a lot of famous stars on the show, don't we, Brett? Famous athletes
We have
and stuff.
famous stars and infamous people.
Politicians, right? Why do we have just like a regular person tonight? I don't know what the heck we're doing, but we got this guy named Dr. John Meisner. He's just a chiropractor.
No,
but you guys say he's
more than
really
that.
great, so
Yeah.
I'm excited about this show.
I'm excited. Thank you so much, guys, for having me here. I really appreciate the opportunity, and it's great to be able to kind of voice to the community, kind of hopefully what I do for you guys, but also kind of interested in seeing what you guys have done with just this whole podcast situation. This is really exciting.
Well, we know what we've done. We want to know what you've done. Now, why are you here?
So,
Because they say you're like a famous guy. People want to fly to see you and everything. Tell us about
true?
what you're doing.
I mean, apparently so. According to some of the reports that I've had, yeah, it sounds like people are pretty excited about what I'm doing. So, again, where I'm from, I'm originally from Coronado. So I was born and raised kind of in SoCal, and grandparents have lived here for about 40 years plus, retired military. I started with my early academics starting at Mesa Community College, worked my way up into San Diego State. So I was a SDSU Aztec guy. And then from there, I went to the doctor program up in LA, where I studied for about 4-ish years in medical and in the science health-based academics. And I was able to transform myself into the professional that I am today, which is treating the local community of Coronado Island with chiropractic medicine.
So pain, back. My wife's got a sciatica that's driving her nuts. So that kind of stuff.
Yeah, it would be, I mean, anything from low back pain, neck pain, acute pain, traumas, car accidents, anything that really would announce some sort of, discrepancy in the biomechanical chain and in the body. So any aches and pains, yes, but we're also looking for wellness, right? As a chiropractor, I am trying to teach and educate the patient that you want to feel as good as long as you can, right? So we're living longer, and how do you want to feel when you get to 70? Those are the choices we make starting at 30, 40, 50 that will ultimately dictate that. So that's my goal in the office, is not only to treat the patient, but to educate them on what we're doing with their health on a daily basis.
So how did you decide to become a chiropractor? What was it about that you said, I want to do that? It made sense to you because you're very talented. I know you do a lot of varieties of other things that you're very good at, but why that?
I get asked that a lot, and the whole like why and your why, and honestly, for me, I've always been very involved in fitness and health personally, but I've watched chiropractic help my family, my grandmother suffering from chronic migraines, using this as an alternative to heavy medications, taxing the liver, taxing the kidneys. So again, doing things as conservatively as possible with the natural ability of the body to heal itself. So my grandmother's, managed her migraines with chiropractic care. My mom was getting chiropractic care when she was pregnant with me. Actually, one of the chiropractors in National City, Chula Vista area, and he's still in practice today, and he's been practicing longer than I've been alive. So I've actually treated, just a few days ago, I actually treated some of his patients in his office for him. He was out of town.
Can you say the name?
Yeah, Dr. Broadbeck. He's a DC chiropractor out in Chula Vista.
Okay.
So I'm treating some of his guys. But really what it came about was just me wanting to help people on a daily basis. I wanted to do something that not only fulfilled my inner desire to give back, but I'm just fascinated by science. I started out with marine biology. I was really interested in underwater stuff. And then I kind of went above land and started getting into the fitness industry. I didn't get bored of it, but I started to get more into the science physiology of it. And I really enjoyed studying things on a micro scale as well as a macro scale. And that led me to the holistic nature of chiropractic, right? As we can't say it in California, but as a chiropractic physician, recognized nationally, we're trying to help the patient look at wellness and health from a different lens, one that is, again, more preventative, more long-term, versus, hey, here's a problem, here's a fix, but a lot of times those fixes in the general allopathic method is temporary or not really a long-sustaining solution.
Interesting.
Including medication. Like, some of these things have lists of side effects, right? And I don't necessarily disregard them, because everyone that needs diabetic, intervention needs insulin, potentially. But there's also type 2, which is diet-based, and we can actually get some of these patients off of
You're
it.
working on that too?
So my goal, it's more functional medicine. So my goal is to try to intentionally educate the patient on how they can, get off as many
That's
meds as
very
they
good.
can
Yeah,
safely.
great.
And I work with their primaries, and it's an integrative approach to living a healthy life.
That's really good.
But going back to why, it was just this inner desire to help people. And I've done sports my whole life: horseback riding, judo, surfing here in Coronado, La Jolla Shores. Messing up my back, wiping out wrong, going to see Dr. Broadbeck, going to see a chiropractor. So if I've used it throughout my whole collegiate as well as my sports kind of upbringing. And I know I've treated several volleyball players, I treat some of the SEAL guys. So anyone that's active, I always say, hey, this is something you should have in your arsenal or in your toolbox on increasing your wellness and the way you feel from day to day.
I would have never thought that you go to a chiropractor and he helps you with your diet.
Sure.
Did you? Do you ever think that?
Yes, I would, because I have a lot of people that are involved with the industry. But yeah, because it's a holistic approach to everything.
Yeah.
It's
Wow.
about wellness.
Yeah.
Very
and
good.
if you think of pain, right? Pain is really just something that's developed in the brain. It's inflammation that we're actually tackling. And when it's on a low-grade chronic situation, that's when you start turning cells into cancer cells. That's when you start really fatiguing the body on an internal scale. So diet plays a role in how inflamed your body is, or aka how well you even respond to chiropractic treatment. Because if you're already on fire and you're trying to calm the nervous system down, I mean, you can do all the right things or all the wrong things and not address some of these other facets, and you're just gonna get better results when you're checking your diet. So those are things we go over in the office.
I don't have any pain right now. Do you have pain?
No.
We're lucky.
So the fire he's talking about, I mean, there's, I would think there's probably, in the last X amount of years, we've seen probably more cases of arthritis.
Yep.
That'd be a symptoms of fire you're talking about, right?
So arthritis could be systemic. It can be osteoarthritis, which is basically the normal wear and tear. But at what grade and how quickly does that advance? It's going to happen in everybody. It's supposed to. That's normal wear and tear. But if you've had injuries, you can increase that in some segments of the spine. We see that in something called DDD, which is
you do X-rays at your place too?
I don't. We can shoot X-rays. I just choose not to. I'd rather outsource that.
Right.
I don't want to mess with the whole X-ray thing, setting up the patient for the images, and I rarely will prescribe or request X-ray unless there's an acute trauma. Typically, some chiropractors practice a little bit different, where they want to see the curvatures of the spine, and it makes sense. I clinically will look at a patient, because I don't treat the image, I treat the patient. If you're asymptomatic but you have a disc bulge, it doesn't mean that yes, structurally you have a deficit right now. You want to tackle that. So again, just because you're not in pain doesn't mean that we shouldn't be correcting some of these deficits.
Sure.
And we look at motion palpation. We're looking at right way, yes or no,
right.
And do you have full range of movement,
right.
yes or no? Because
all that kind of stuff.
yeah,
like
because
that.
even you right now, you're turning partly with your shoulders. You're not doing just a full rotation in your neck. So it's these little cheats that we do, these micro compensations that add up over time.
Are you seeing more? How long have you been doing this now?
I've been practicing probably closer to 4-ish years now, I would say, out of school. Yeah. So
are you seeing more of a certain case of individual coming to see you than you were when you first started, or is it pretty much the same?
As far as demographic goes, I think social media has been really big on getting the word out. It's much more approachable now. I think before, even with just regular MDs and doctors and physicians, people were not taught to ask questions. If you questioned a doctor, it was almost disrespectful. But I think now doctors, and doctor means teacher, that's the definition of doctor. I think that the patient is placing more demand on the doctor to explain themselves, and they want answers. And if they don't get the right answers, they're going to the internet, which I don't recommend. But we have so much more information now to make educated opinions that I think that people are more open to searching. So in short, to answer your question, I see everybody between 6-year-olds, 4-year-olds, pediatric, all the way to geriatric. So it's going to be people in their 70s, 80s, Medicare patients. But really, it's just
take Medicare. Is that?
I do. Yeah,
Really?
I'm fully
That's a good point to know, right?
and with Medicare right now. Yeah.
So somebody can come in and just give you your Medicare and they don't really pay a deductible.
Yeah, it's just a low deductible, low copay.
Huh?
Oh, well, deductible. There is a deductible, but usually that's been met depending on what they're already
great.
seeing. But the copays are pretty affordable. Yeah, I think it's as low as
So let me tell you a story. So this is back in Palm Springs, like 30 years ago. There was a friend of mine flew all the way from Florida to Palm Springs to see this chiropractor, and he said the guy was like magic. So I never had any problems at that time. But then a few years later, I started getting some problems. So I went to the guy. Well, he's a kinesiologist.
Kinesiologist.
You're
yeah.
not that, are you?
I have a bachelor's in kinesiology.
Oh, you
yes.
do?
Yeah.
So,
I actually
but
got
here's
that
what he
training
did.
this
Now,
day.
here's what he did. So I lay down, and he has put your thumb on the roof of your mouth, put your arm over here, put your finger on your head and different stuff. And he kept writing things down for 15 minutes. And then he knew everything going on in my body. The guy was like a witch doctor. He was unbelievable. Maybe you know him. His name is Alexander Edis. And he's famous. He's taught like half the people in Southern California.
Okay. I personally haven't come across
So
this
tell me
name,
about
but-
this kinesiology thing, because I don't, it's unbelievable.
So kinesiology, I mean, when you break down the terminology, it really is just the study of the movement of the body. It really is what that is. So it's like biomechanics or physics, but pertaining to limbs of human anatomy, not just bridges and levers. So we're talking about, inertia and how, and that's why I love judo and martial arts, because you learn to use your opponent's gravitational and strength and weight against themselves in order to create some sort of effect or some sort of performance. But yes, kinesiology is the study of the human body and the movement of that. So that he might be more motion actor, and everyone has a different philosophy in the sense of like more exercise, more stability. So my philosophy is that you need to create motion in the body, you need to create less of interference, and then you start building. Once you mobilize, then you stabilize, and then you strengthen. So you build the patient up. You don't just go, okay, we're just going to go straight into heavy deadlifts and squats. And that's again more biomechanical, but there's also the wellness side of things with the nervous system, where if the nervous system is calm and relaxed and you're getting it into a less fight or flight state, you're naturally going to just optimize your body in every way.
He seemed to know my nervous system, though.
Yeah.
He seemed to know
Yeah.
that, too.
Yeah, and that technique you're referring to seems like a little bit of muscle testing, a little bit of like internal energy movement with getting the nervous system to tap out by pushing and emphasizing on other parts.
Crazy.
And kind of almost, and it's kind of a head game, no pun intended.
Yeah, right.
Because the nervous system and the brain, they all play a role in literally every vital function of the body. When you're sleeping, you're not dying because your body is telling yourself to breathe even though you're unconscious.
Well, he helped me immensely. I love to get my neck cracked, by the way. Oh, I love it. Oh, my God, I love it.
And
You ever get it done?
I have.
Oh, it's great.
It's a feel-good sensation for sure. But and I always tell patients, it feels good, but really the it's like chess. What I'm trying to do is I'm trying to actually create movement and performance in the body by being strategically with these adjustments. So when somebody says just adjust me, it's much different than somebody just going, I'm just gonna crack my neck, because you can do that at home. You get a little bit of a dopamine release.
Really?
Yeah, you get a little bit of a feel good. So that's why when you're stressed, you see
can
some
crack
people.
your own neck at home?
I don't recommend it. Can you? Yes. Can you jump off high, stories and land, plug yourself? But I don't recommend it. Not.
So how could you take
That's
care?
that's how the Hunchback of Notre Dame got started. He
That's
started
right.
cracking
All
his
right.
neck, Right.
How would you
we're
treat?
just hanging out with gargoyles, having too many conversations.
How do you treat three-time Mr. Universe? How do you treat big guy like this, huh?
You'd be surprised. I've treated people 300-400 pounds probably.
Really?
Yeah, you just have to move the table around a bit, and
I've seen him. He's very strong. As you can tell, he's capable in a lot of ways.
Yeah, and a lot of times you use, again, inertia, you use the own body's self against the joint. So a lot of times a heavy guy will roll into that adjustment, fall into that place. And if you line the patient up with proper technique, you don't need a lot of force. Yeah, you should. It's a very safe, very comfortable procedure.
It's a technique.
It's not supposed to be violent.
No, nothing should be violent.
No. It shouldn't be violent.
What was the question? You have a question? Do we have somebody in the audience that has a question?
No.
You sure?
I have another question. So who's the most famous chiropractor in the United? Like there's always a famous somebody of real estate, famous doctor, famous this. So who's the most famous chiropractor that's
You
ever
go-to person?
made a name for himself in the United States? Who would that be?
I haven't really studied that too much. Like I guess I've just been so immersed into the science and just the profession as a whole. I haven't
Well, you
really,
could be that famous person like
I
Jack
haven't,
LaLanne,
I guess I respect the whole profession as like a body of chiropractic, right?
Yeah.
I guess anyone that treats a patient with reverence and respect and really has the betterment of the patient in mind, it's like then you're a good chiropractor. So as far as like celebrity chiropractors go,
Yeah, celebrity chiropractor.
Instagram guys, like
Guys
I
on the
know
talk
there's
shows
like,
and all that. Nobody
there's like
surfaced yet.
again, and that's the business side of things. So
Yeah.
you start to study competition in San Diego, for example. There's one guy, I'll give him a shout out, Dr. Bo, in San Diego. I've had even several patients come from him and say, "Oh yeah, I saw Dr. Bo." So he's done a great job of marketing himself on social media, specifically Instagram, even some YouTube. He really thinks outside the box, but that doesn't necessarily pertain to the treatment. So going back to that, yes, there's the profession, and then there's the marketing, the being the business owner, and that's something I've had to come to terms with learning, because they don't teach you that.
Well, you're
in
really
med
good at
school.
that part of it too, though.
I'm working on it. Yeah, that's been a self-taught education. So it's taken some time, and doing things like this, it's just exposure. And anyone tells you it takes time. It takes patience to have.
So there hasn't been any singing chiropractors or comedian chiropractors or anything like that?
Not yet.
So there hasn't been any singing chiropractors or comedian chiropractors or anything like that?
Not yet, but if you want to make me the first right here, man, I mean, cover your ears, otherwise I'll have to treat you afterwards for ear pain. But I don't know
Imagine
about
getting some
that.
bad jokes when you're trying to relax.
Oh, I give a lot of bad jokes. I actually made that joke earlier before I came here today with one of my patients. I was telling her about some concert that a friend was going to, and then I said, you know that one song, and then I was kind of like humming it a little bit, but this is when I'm on her neck, of course, and I was like, trying to cover her ears so she didn't have to listen to it, because I don't want to have to charge her for more adjustments than she needs, So
So the guy in our day that I used to was known was a guy named Franco Colombo.
okay.
Oh, yeah. Well, he's a bodybuilder, though.
Yeah, but he was also a
I
very.
feel like I've heard.
He was a chiropractor?
He was my mom's chiropractor.
Really?
Yeah, he worked on my mom, and he was a good friend of ours. He was a really well-known chiropractor to a lot of celebrities in the old days.
Okay.
He passed away a couple years ago.
Kind of an OG guy. I feel like I did hear. I've heard of a Franco in the industry, but
He
yeah,
he was
A
amazing.
bodybuilder, too, right? With Schwarzenegger?
Yeah, they were buddies.
Yeah, okay.
That was his best friend. But,
Oh, okay.
but Franco was a two-time Mr. Olympia.
Someone just mentioned that recently.
Probably one of the strongest bodybuilders. I mean, he still holds powerlifting records, but just an amazing individual. Knew everything about everything that he's talking about.
That's interesting.
Well, he had probably experienced a lot of these injuries himself, and unfortunately, I
Yes,
feel like when
right.
you can kind of go through it, you can kind of put yourself in that patient's shoes to an extent, and say, wow, I know what you're going through because I've had similar symptoms. So, and again, that's why I always talk about not limiting your body based on the mind too, because the mind-body connection, yes, it's there, but the body's amazing when you let it kind of do its natural thing and you don't put it in a mental box, and you see that with doctors and patients today where, you'll never walk again, and that person's like, yes, I will.
Sure.
And they do. Maybe they're not running, but, they're at least out of the wheelchair. And so we see little mini miracles all the time in
Sure.
science and in medicine.
Dr.
which is
Colombo
great.
was one of those people, by the way. They told him he would never walk again.
Yeah.
Okay, good case in point.
Yeah, exactly.
I got to
And
tell you
agree.
though, he really I've watched him operate, how he works. He worked on my daughter Madison. He worked on my brother-in-law,
Wow.
and he's like, it's almost like you're in a class when he's working on you. He's educating you about what he's doing as well.
Yeah, that's very good.
Yeah.
Very good. So getting back to sciatica, so how many treatments would she have to take? What is she going to do? There's no neck thing on that, is it? It's down here, right?
Yeah, it's all connected.
She's still golfing, but she's taking Advil for weeks and she can't kick it.
I would still address the neck too, because if you think of, you
Oh,
have to look
okay.
at her posture, because if her head's
Oh.
coming forward, you're naturally putting tension in your low back.
I see.
But and again, we could shoot imaging, but I would even
No.
start there. But how old is she, if you don't mind me asking?
Like 70.
Okay, yeah. So there's probably some wear and tear in there, and I would address that and say, yeah, realistically, you're not going to feel 20 again. I can't promise you 20, but let's get you down from, if you're at a 7 out of 10 pain, let's get you down to a 4. Let's get it manageable. Let's keep you playing golf. Let's get you back to play,
Yeah,
right?
right.
Could sciatica also be affected by the foot at all?
So sciatica
Really?
is usually it's an umbrella term used to address the sensation of pain going down the leg, but the diagnosis can be different and vary. Piriformis syndrome can cause sciatica symptoms. Sciatica is the symptom; it's the feeling. The obstruction or the pathology can be a disc, it could be muscular, it could be tendinous, it could be a little combination of both. It could be nerve root related, so it may be coming off. And that's when we get into radiculopathy, which is addressing, okay, where's the numbness signaling going? Is it going all the way down the leg, back of the leg, laterally, aka to the side, outside of the leg? What's the intensity? Are you experiencing weakness along with this, which would be like a myotomal defect or deficit? And then is it left side, right side, both sides?
Yeah.
And then so you want to clear some of the red flags.
Okay.
Is this a bigger
Well,
problem?
never-
Once you
never-
establish that baseline, then my goal is to centralize or get that sciatic to start climbing back towards the local low back. But in turn, is it a foot problem? Is it a low back
Gotcha.
problem? It could be completely separate. So that's part of the diagnosis, right? It's trying to evaluate, okay, did you sprain your ankle? Is there anything else? Was there a slip and fall? Was there something that might elicit maybe me looking at both? Or is this a top problem, spine problem? that's radiating or referring, giving you kind of a phantom sense or a situation where, why aren't you being? It's in the foot. Okay, I hear you, but I know it's coming from the low back.
I got it.
I had sciatica last time I had it. I can tell you.
You had it, huh?
I did. I had it the last time I had it. There was a Filipino doctor who worked on me. He was called a helot.
Really?
And it was. I mean, it was
How many times did it take?
one.
Wow.
But he did something very unusual. He didn't go to the back. He went to my foot.
Interesting.
And he
Maybe
put
like reflexology
his
or
thumb
something.
right in the area of the arch of my foot, and all of a sudden I had this shooting pain from my foot go up the side of my leg,
Wow.
right up to where the sciatica was, and he held that for like 2 or 3 minutes. I've already hit him. It was so painful. And then it went away and it never came back.
That's so
Wow.
interesting. Yeah, and I think that's so
Wow.
interesting. Yeah, and I think reflexology would probably be in line with that. Also, fascial planes. We talked about that a little bit. So the myofascial system works in three-dimensional matrices, and it has different points. Actually, there's an Italian guy who probably appreciate this, but his name's Luigi Stecco, I believe was his name, or Antonio Stecco. Stecco is the last name, but the technique is called stecco-fascial manipulation, which I did several courses in this and extracurricular while I was going through all the other studies, because why not? And then talked about the 3D matrix, and so the whole assessment is figuring out where these points are, but they can stem all the way down to the foot. So what you do with their exam is you essentially, and it's only offered to medical doctors, it's fascial manipulation, it's an Italian thing.
You know how to do that too, a little bit?
Yeah, so I've done,
Wow.
I've had a background in that, but you basically can start from the ground
It's
up.
like a checklist of things you go through, right?
Yeah, you're actually, is this one more tender? Is this one more tender? Okay. And then you're taking notes and you're figuring out, is it a linear? Is it spiraling? What is the pattern? And then you go from birth, you go from straight up trauma from the canal, getting yanked out to, how, like, let's go back.
Wow.
What was your injury? Sometimes people think of like, well, last week I had for dinner, I can't remember. Some people go, well, I had a surgery, but the real trauma was when I was 6 years old and I was on a jumpy house and I fell off and I twisted my neck. And then that small compensation throughout the entirety of her life was never truly addressed or even worked on, and then she let her body kind of grow with it, and so then these lines of tension develop over time and then they just thicken. So I mean, it's not unreasonable to say that maybe he was hitting some fascia points, and I don't know his methods, but that's the point is, like, all these therapies, and as a chiropractor I don't ever disregard it because they're there for a reason, because they work and people get relief from it. So
We got his address going by on the screen? Okay,
Good.
so your office is behind the bank?
yeah, so directly behind US Bank, open parking lot, very easy access. We have patient parking specifically for you guys, but then we also have just a big lot for it. But yeah, right in the Rite Aid Bonds, US Bank, the
Behind
old
the
Village
movie
Theater.
theater, off behind Orange right there.
Exactly.
100 feet behind.
Yep.
It's a great area.
Yeah, it's perfect. It's right there on the corner, and it really helps when people can swing in, get their appointment, and move on with their day.
If you got pain problems, if you got diet problems, if you got diabetes, this is the man you want to see.
And if I'm not the guy, I'll send you to the one you want to see.
That's right.
Yeah,
Dr.
we
John
play
Meisner,
together.
I really appreciated spending time talking to you today. What about you?
I had a great time.
Yeah, it
Every
was
time
awesome.
I talk to you, I feel like I learned something new each time.
Yes.
Hey, it's
I
all
learned
about
a lot.
learning. We as individuals are always, students for life, in my opinion. So if you're not learning, in a way, you're dying. So we always need to be pushing ourselves to another level, and that's the fun of the game, right?
right.
It's otherwise it gets kind of dull and repetitive.
We'll do some closing wisdom for our listeners, and let's sign off.
If you're starting to feel pain anywhere in your body, don't wait to where you can't move. Get it fixed and then taken care of before it gets worse.
That's good. Very good.
Love it.
Okay, everyone, we will see you soon on the Brett and Larry podcast show. We had fun tonight. I was wondering who the heck this guy was, but I had a really, really good time.
I enjoyed myself. Thank you so much, guys, for hosting me and allowing me to be on your show.
Yeah,
And,
of course.
I'm so excited
Very nice
to see
guy.
where
We
this
enjoyed
this
it.
goes.
Thanks.
Yeah,
Thank you very
absolutely.
much.
Yeah, thank you.
Everybody take care.